Before Stanley will share his experience, I would like to show his before and after real quick, and then after that, Stanley will share his experience to the audience. And I'm gonna show the audience what he looked like before, and that was him. And you know, he has hair, but it's thinning the whole frontal area. So we just give him more depth to hairline, more density, and you see his face change. Even though he had hair, but if you add more density, it looks different. The hairline look lower. Right hand side, left hand side, left hand side. You see how he had hair but thin, but now more volume density. Top view, top view. Okay, so I'm gonna turn over the stage to Stanley. And Stanley, why don't you share the audience from the beginning how hair loss affected you, your research, and describe what surgery day like and recovery and all that stuff.
Hair loss didn't do much for my self-confidence. Just looking in the mirror each morning as I try to groom myself, I just didn't like what I saw. Thinning hairline, it got to the point where the thinning was very noticeable, and no amount of gel or hairspray would keep my hair up. It got to the point where it was just uncomfortable to have the hair just constantly falling down and not staying in place, especially when I worked out and went running. So I decided to look into a hair transplant, checked the internet, found Dr. Diep, checked out the reviews. Reviews looked pretty good, so I said, why not just give it a shot. Made an appointment. I waited several months to get an appointment with Dr. Diep because his schedule was so booked. And finally, when the day came, I was supposed to be at his office at 5 a.m. I believe it was.
5:30.
5:30.
Yeah.
So I had to admit, I was asleep for most of the procedure. Overall experience was very good. Results were absolutely amazing. As you can see, the volume of the depth it's like night and day. And my confidence is back. I've gotten quite a few compliments from friends and family, and now everyone says I look a lot younger. I definitely feel a lot younger, and I'm happy to say that when I look in the mirror, I'm pretty pleased with the way I look, and overall it's just been absolutely positive experience, an awesome experience with Dr. Diep. It's been about slightly more than a year, and here I am, 1 year follow-up. I'm fully recovered. I don't have any numbness. I don't have any pain whatsoever. Whatever discomfort and pain I had in the beginning was definitely well worth it. Just
it's part of the recovery.
Part of the recovery, and with every surgery, and just a little patience, and having a good positive frame of mind really helped in the recovery process. And as you can see, the end result was definitely worth the wait. So overall, that's my experience with Dr. Diep. I highly recommend his services. You won't be disappointed. Just be prepared to have 1 year, wait a full year to get your results and to be fully recovered.
Yeah, because it just surgeries, we can control how natural it looks and how dense it looks, but in terms of recovery, in terms of hair trying to grow back and those stuff, it's difficult to control, and no doctor can control that. With that said, with AV surgery, there's always some form of recovery, but I'm extremely happy with his result, and it really by just minimally change the hairline a little bit and add more depth, and by giving density, it framed the face better. And when it framed the face better, you just look younger, and he does look younger, and it really brought back his handsome look, and that's the key. And again, hair transplant is both surgery and artistry, and you want to make sure you have both to give the best result. And it's one of my greatest satisfaction as a hair surgeon is to see a product see my work come to life and really make a positive impact on his life. And that's one of the great satisfaction I get out of AV surgery. And so thank you, Stanley, for sharing your personal journey, and hopefully that will give a glimpse of an honest glimpse of what the surgery and day and recovery and those stuff. And it is a blur for a lot of patients because I give them medicine and it helps them relax. Some people their mind they remember a lot, but majority of them they don't remember a lot, and which is good because you don't want to remember the painful part of doing the recovery, doing the surgery. So this is the year follow-up and the personal journey by Stanley. Thank you.